it's very easy to strawman arguments, especially maybe by people who haven't paid attention to palpation, as you said. If we've put in a good 20, 25 years of mindfully doing this. So it's like we might have a skill. Maybe we're playing guitar and other people are just learning their chords. And maybe there's a difference there, which is difficult to perceive. But based on the research that we've laid out, I think it should at least interest you that perhaps there's a there. There's something there, considering all of our knowledge about touch and how it benefits pain and anxiety. And forget we talked about how it doesn't. We talked about pain a little bit and how we don't touch pain. But there's a lot of research about post-surgical clients that have cancer, for example, and how touch decreases pain levels significantly, decreases anxiety, decreases time to return to function. I mean, there's just
Increases cortisol. Increases parasympathetic, the
there's
parasympathetic system.
immune benefit, immuno benefits to touch. I mean, there's so much there. There's so much there. And then if you tag that along with our ability to improve our sensory processing, and you tag that along with all of the machinery that we've discussed that we have in our hands and the sensitivity of that machinery. Like we're talking about we're talking about sensitivity to the extent that people can learn braille and people can pattern recognize. It just seems to me like people should be erring on the side of this is an important skill that I should have as a manual therapist. And I'm going to argue now as a trainer. And I don't want to bogart the conversation. I'll pass it on to you. But another thing that we've realized is at one point we were only teaching palpation to our manual therapy students. And then we opened it up to anyone taking any of our courses in mobility training and strength training, the ISM, the FRC. And what we found is that the benefits of of palpation training to trainers. I mean, it's the benefit is insofar as you can be as specific as you want or as general as what you want with your training. And general inputs lead to generalized results, and specific inputs lead to specific results. Now, we don't teach our trainers to become therapists, but the ability to just identify anatomy, understand the three-dimensional framework of the anatomy. Maybe they're not going to be palpating for tissue damage per se, but their ability to localize tissue, their understanding of anatomy and how it relates to other layers of anatomy and how the movement between layers occurs, and being able to feel that movement and to feel how things achieve length. Trainers stretch people all the time, but never along that time did we ever teach them to put their hands on what they're stretching as they're stretching, just to see if they can, subjectively get information that they can then utilize, not necessarily with regards to therapeutic intervention, but with regards to exercise intervention. It's immensely positive for trainers to also experience this kind of learning.
Yeah, it's huge. I mean, during the seminars, I've had from orthopedic surgeons come to an FR course,
Mhm.
just to get better at palpation, so that they may be able to for whether it's injecting somebody with something, and being able to be a little bit more specific in a knee injection or a shoulder injection.
Mhm.
To like you said, now we're opening up to trainers, and we're not going to make trainers, like you just correctly said, therapists, but if you want to be, let's say, a little more specific with your training, let's say we did this with the FR summit that we just did in Prague, and want to do some exercise training for the ankle, and you want to be a little more specific to some of the ligaments in and around the ankle. A trainer being able to understand the anatomy and being able to identify where that anatomy is, I think you'd be a lot more specific with the load that comes with exercise onto those tissues. And
Mhm.
that, of course, is going to result in, better results because you're a lot more specific into loading that tissue and just generalize exercises.